Hi everyone, Jackie from Active Health Clinic, and today I'm talking about the comorbidities that we can have alongside, let's just say, our primary diagnosis. So this is, obviously I'm an exercise physiologist, not an artist. My lovely gingerbread man here. So I wanted to talk about, well, what else can go on within the body, why we are more prone to these types of things, and I guess settle some fears, some questions, those types of things around, well, do I have all of these different conditions going on? Do I need to get multiple diagnoses, see multiple doctors, etc., etc.? And this is also a very frequently asked question from my patients. So what I'm talking about here is that obviously we have the brain. It is our control center. Now, the brain being our control center, it actually controls all of the different systems in our body. So I've only written 4 of them here. There's many of them. And this is why a lot of invisible illnesses are classified and known to have multi-system dysfunction, okay? So the reason that this happens is that we have this increased sympathetic drive. So the sympathetic nervous system, which is our fight, flight, freeze, faint. So this is in overdrive because, like we have explained, if you are a patient of the clinic, there are things that have happened in your life, whether it's been your entire life of a build-up of stressors, it's been 2 months or 2 years of a build-up of different stresses, okay? To the point that the brain kind of gets stuck on in this sympathetic drive as a way of protecting you. So why we tend to have an array of symptoms is because these systems will go in different directions. So for example, the gastrointestinal system, we don't really need to digest when we're trying to fight or run away from a tiger. We don't need to reproduce. So the endocrine system and our hormone system often gets forgotten about. It's dysregulating. Whereas, for example, our immune system and our motor system, they will tend to be a little bit more upregulated. So our motor system in particular, because we think about, well, we need blood flow to the muscles to be able to run away from the tiger or fight the tiger, okay? Then immune system wise, and over the years, a lot of my patients have thought, I've got a really weak immune system. I'm just getting sick all of the time. But after speaking with one of our specialists that we work really closely with, he'd actually explained, and it makes a lot of sense, that our immune system is actually overprotective. So it would only take a small insult, such as change in seasons, change in weather, that we are exposed to allergens or changes, and the immune system is identifying that as a threat, and therefore we can become unwell or present with immune-like symptoms. And this is where you often use the example of, glandular fever, when, let's just say, you're studying for your exams and you're getting really stressed, that you may start to experience sore throat and tender glands. So the brain identifies that there's a threat in terms of you being stressed for exams, and you're getting an immune response such as the sore throat and tender glands, but we don't actually have any active case of glandular fever. So the immune system can actually be over-responsive. So what tends to happen is that, so in terms of these other comorbidities and things, so we can have maybe diagnosis and symptoms of POTS, OI, orthostatic hypotension, dysautonomia. We can have chronic pain due to the increase in muscle tension. We can have things like gastroparesis or slowed gastric emptying, food intolerances, because the gut hasn't been prioritized, because the blood flow is actually redirected away from the gut, and also our reproductive organs because remembering we don't need these to survive. So blood flow gets directed away from this center of the gut and hormonal system and reproduction because it's not needed to survive. And then what also happens is because of, chronic pain, autonomic dysfunction, we can have, sleep issues, or we have a lot of difficulty with relaxation because we are stuck in this, okay? So I just wanted to be able to explain that there is a reason why you may experience an array of symptoms, and yes, we do often see that people will have different specialists for these reasons, and we can also, headaches and migraines are another thing that will happen. But we want to come back to here, the control center, and how can we work on decreasing this sympathetic drive on your nervous system. And obviously that is what a lot of our AHC program is about. It's about trying to regulate your nervous system better so that these systems will start to neutralize, and you'll start to feel decreases in pain, better digestion, less painful periods or more regular menstrual cycles, better libido, all of those types of things. So we treat the whole person. We look at your symptoms overall, working with all of your specialists. But I hope this has really helped to understand that we don't have to treat all of these things separately. We just need to work on our main control center, which is challenging and will take time. So if this has resonated with you and you would like to share this with friends, family, or somebody that really needs to have a bit better of an understanding of what's going on with the whole body, please like, share and tag them, and make sure you head on over to our YouTube channel to watch many other videos around these types of things. Thank you.